Hey everybody, John Newman here, talking to you about the state of the clinic. So first off, clinically, we've got a urologist that have ordered their cystoscope and will start doing cystoscopy here in the clinic. This is huge for our patients because it gives them immediate evaluation, but it also spares them the expense and us the expense of when they go off site. ENT's got a new fiber optic scope. We're using the bedside ultrasound for ultrasound carpal tunnel injections here in the clinic. So that's a quick update on what we're doing clinically. That's fascinating, as well as all the core of what we do every day with all the specialists coming around. So let me tell you about how we're doing on our quality. All right, so this is our clinical quality. And this is something I want everybody to look at because we should be incredibly proud. Right now, your fit testing, we're screening our patients about 70% of the time that they need a colon screen they're getting. The fit test, if and when it's positive here, we're able to use our relationship with Access Health to get them a colonoscopy. That's awesome. Mammogram screenings, we're doing about 166 a quarter, which puts us at about 85 to 86% of our patients who need mammograms are getting mammograms. That's awesome. That's top decile in the nation. We should be incredibly proud. And I give a lot of that credit to Jessica, who's right behind us over here, for the program she's doing with Women's Health. Blood pressure controlled, 140/90. For the year, we finished off at 77. Amazing. We're actually having discussions about should the goal be 140/90 or 130/80. The bouncing back and forth is how do we protect our patients, but still protect them from getting their blood pressure too low, passing out, falling, and breaking a hip. And so that's the conversations we're having this year. We're going to shadow both of these goals. The goal just got set up to 90. So 90% of our patients we want controlled less than 140/90. So if your patient gets a blood pressure greater than 140/90, let's engage that discussion. And then diabetics, A1C less than 8, 56% of the time, and that is a continuous improvement up from 50% earlier in the year. What does that mean? Freestyle Libre program, access to medication, and good education seems to be working for our diabetics. The one thing we're adding next year, depression screening. We haven't asked this question because we really haven't had a great solution for what to do with our patients. But we're really driving some goals, moving mental health forward for 2023. And so we're actually start asking the hard questions about, are you depressed? Are you anxious? Are you sleeping? And maybe what we might be able to do to help you. All right, so that was quality. Now the other pillar of this, quality talks about how well we're taking care of our patients. The next question is, how well are we taking care of our volunteers? So recruiting a stable source of volunteers is huge. This is class of 2021. That was a banner year. This is class of 2022, even bigger. And so this is still a great place for people to come that can find purpose, and there's joy in medicine here. And I think that's one of the biggest secrets we've got. Yes, this is a Volunteers in Medicine free and charitable clinic. It's really good for the patients, but it's really good for the volunteers too. And we need to stay true to that core to keep it. So here we're in the back area that has been totally revamped over the last couple of years. The effort's really on the wellness and food as medicine program. And wellness came out of 22 after COVID and has just soared. They have seen over 1,400 patients since they've really fired back up and have distributed food for 1,100 patients. They have conversations daily with our patients about what are we eating, how much are we moving, and what are your goals on health? And this is all part of the development. This is our connection to the community. When our partners Deep Well and Second Helpings bring us food, we give them fresh produce to take out to the community. Why? Because we still out there and have conversations. We're volunteers in medicine, and people are like, who is that? Who is them? And I appreciate every conversation you have about volunteers in medicine. I appreciate every patient that you talk to that's serving you at the restaurants, that's working with you in the landscape and the golf courses, because we're still not meeting the complete need for our patients. And then the volunteers. Everybody that comes to the island is looking for a purpose and what they can do to contribute to their community. This is a great place to do it. All right, a lot of stuff happening, but the core of what we do is just people taking care of people. And for that, I appreciate every one of you, I appreciate the time you give us, and I appreciate the conversations you're having out there with our community about the good work we're doing.